This is All India Radio. In the program Spotlight, now we bring you a discussion on safeguarding against air pollution. The participants are Dr. Arvind Kumar, pulmonologist, Medanta Hospital, and Omvesh Upadhyay, AIR correspondent.
To discuss how the deteriorating air quality impacts our health and what precautionary measures we can take, Dr. Kumar, I would like to know that in what ways does severe air quality affects human health?
So the severe air quality is actually a medical emergency, affects health of all those who breathe in a very, very brutal way. So I would like to start answering this question by first addressing what age does this effect start. The startling revelations in the last few years have come that the damage actually starts even before we are born. So when a pregnant mother in a polluted city is breathing toxic air, the chemicals are going through her lungs, into the blood, through the placenta, into the developing child, and it starts its harmful effects from there. So that's first piece of information, that the damage starts even before we are born. When we are born, as soon as we take our first breath, if the air quality index is 500, if the PM 2.5 is 400 plus, it's almost like equal to about 15 to 25 cigarettes. So that's the kind of air the child inhales from the first breath. It damages his or her windpipe, the lining of the lungs, and these toxins that get absorbed into the blood and starts impacting all organs from brain to toe. And this damage continues through the childhood, into adulthood, into elderly age, till our last breath if we continue to breathe polluted, toxic air. So effect starts in pregnancy, effect continues throughout our life, and it impacts every organ from brain to toe. The effects can be classified into immediate. For example, these days everybody is reporting red eyes, itching in the eyes, burning in the nose, soreness in the throat, metallic taste on the lips, breathing difficulties. These are all immediate effects. Then the short-term effects, children are noticing a lot of asthmatic tendencies. Adults are also noticing congestion in the lungs. Those who already have asthma or chest problems are reporting severe deterioration. Elderly people are coming with pneumonia. So these are all short-term damages. But more sinister is long-term damages, which includes decreased IQ development in children, premature hypertension, heart attacks, brain attacks, lung cancer, and even diabetes and obesity are now being linked to exposure to pollution. So if you look at the spectrum, there is a very long list of diseases, disability, which occurs secondary to pollution, and very sadly, it's responsible for millions of premature deaths across the country.
Indeed, Dr. Kumar, you talked about the symptoms that breathing in bad air quality brings to human body. I would like to know more from you about this, because there is a lot of talk about the particulate matter 2.5. So in what ways does it harms the human health when a person continuously breathes in this PM 2.5 air?
So we have two types of toxins in the polluted air. You have the particulate matter, which is divided as PM10, which is 10 microgram particle, to PM 2.5, which is 2.5 microgram, PM1, which is 1 microgram, and less than 1, ultrafine particles. And then you have various gases, from carbon monoxide to oxides of nitrogen, oxides of sulfur, and various other gases. Now these gases go in and come out, but the fine particles, which is PM 2.5 and smaller than that, these fine particles go up to the terminal part of the lungs, and they tend to settle there and thereby are responsible for a chronic long-term damage. So those particles settle down there. They keep releasing the chemicals on their surface, and most of them are silica. So that in itself is also a toxic material, and it is presence of these particles that I'm seeing in lot of, because I'm a chest surgeon, so I operate on 3 to 4 cases of lung diseases every day. and now I see deposits on the lungs of even teenagers. And the reason is that they are breathing polluted air and these particles are getting deposited in the lungs. Once deposited, they are there, they cannot be cleaned, and they cause long-term damage to the lungs, and the chemicals also go to the blood and cause damage to all organs of the body.
When we were discussing about that, how this is affecting our health, Dr. Kumar, we have seen a rise in cases of cardiac arrest during winters. Does the deteriorating air quality have a relation with it?
So it's a proved fact that whenever there are periods of spike in pollution, few days to few weeks later, all hospitals experience at least 5 to 10 times increase in the cases of heart attacks as well as brain attacks. So higher incidence of brain attacks and heart attacks. Heart attacks leads to cardiac arrest. These are known facts which all hospitals and doctors experience few days to few weeks after the periods of spike in pollution.
Dr. Kumar, seeing the rise in cases, be it respiratory related or cardiovascular, does the hospital authorities do any special management to manage these cases?
No, there is no special management. It's just that as this pollution season approaches, the management knows that there is going to be a sudden increase in the number of children reporting to your casualty with respiratory illness, number of elderly people requiring admission to ICUs, paralysis cases, heart attack cases. So you know that you are going to be short of beds, your doctors are going to be stretched because there are too many patients. So hospitals do prepare for these by putting people on duty. But the thing is that instead of this is like a reaction, more important as a doctor for me is to take measures to not let this happen. Prevention is where I would like to see the focus shifting rather than letting it happen, people falling ill and then taking care of them in the hospital.
Definitely, doctor. You talked about that major and big hospitals are well prepared to handle cases like these. But do you think that in recent past we have seen that smaller cities are also experiencing deteriorating air quality? Do you think the hospitals able to counter that?
So let me make this statement that air pollution is not a Delhi-centric problem. We used to say that it's a problem of North India, namely Indo-Gangetic belt. But today I would like to clarify that air pollution is a problem across India. And therefore there will be higher number of patients in all the cities, and this problem of bed, etc., I'm sure would be faced in every city, and I'm sure the local respective governments must be taking measures to face this challenge.
This question is for the COVID survivors. As we have seen that after contracting COVID, the lung capacity decreases. So what special measures would you advise to COVID survivors?
COVID survivors who had significant lung involvement during their COVID period, which was not severe enough to cause death, but there are a lot of people who are on oxygen, those who have compromised exercise ability, those who have moderate involvement, but when they exercise they get fatigued, and mild involvement. So all those people who have diseased lungs post-COVID, for them this is a very bad time as far as their lung health is concerned, because this kind of air will do lot of damage to their already damaged lungs. So they should stay indoors, they should use masks, they should use air purifiers in their rooms. I am not at all a proponent of air purifier as a solution to air pollution, but for these people who are already having diseased lungs, I would strongly recommend air purifiers to be put in their rooms so that there is no further damage that occurs to their lungs. They should not be exercising outdoors, and till the time the pollution levels comes to little better level, they should probably be inside the house exercising precaution and taking their medicines regularly in consultation with their treating doctors.
Indeed, Dr. Kumar. Just to get the answer of a general query, that is it only about masks or taking right medicines or staying at home, or one can also take some special diet to counter the pollution that one is breathing through his lungs?
So there is no specific anti-pollution diet. I would like to, through your huge audience, I would like to send out a clear message. There are a lot of off-the-market, off-the-shelf products which are being touted by advertisements as panacea for air pollution problem. All I would say is that you should take healthy diet, which should be a good mixture of carbohydrates, fats, proteins, minerals. So you should take various. So, the vegetables are good. You should take fresh home cooked food, junk food, stale food, food which has been stored for a long time, food which has a lot of chemicals added in it, artificial flavors and all. Those kind of junk food should be avoided. So fresh cooked food in the house, lot of green leafy vegetables. High colored vegetables have antioxidants and help in recovery. Dry fruits like cashew nuts, almonds, etc., they also are rich in antioxidants. Fresh fruits and plenty of water. So a normal healthy home food with good amount of water intake is what will prevent you from falling sick. But I am not saying that this is an anti-pollution diet. There is no known substance which can 100% prevent damage to your lungs or other parts of the body from breathing polluted air, no matter what the advertisers might be saying.
Thank you so much for answering this and rightly pointing out that there is no specific anti-pollution diet. The Delhi state government has ordered to close all the schools right now. So we already know that due to pandemic the schools were closed from past years, and again it happened this time. And we also keep in mind the deteriorating air quality. I want to ask you about this, Dr. Kumar, that how much does this deteriorating air quality affect the health of children, both in physical terms as well as to their mental health?
So children, as I said in the beginning, are most vulnerable because they are shorter in height, and which is where the pollution levels are highest. So they get maximum exposure, number one. They breathe faster than adults. So their per minute intake of toxins is more per body surface area than adults. They have growing tissues which are more susceptible to the effects of chemicals than adults, where the tissues have reached maturity, and they often tend to run, play in schools, which further increases their respiratory rate, thereby increasing the amount of exposure to the toxins. So all these things put children, and their immunity is comparatively lower. So they become a special affected group as far as air pollution is concerned. And when the levels are so unhealthy as they are these days, I think there is no other measure but to keep the children at home and not let them go to the school. But I must clarify that this is not a long-term solution. This is a knee-jerk reaction, temporary, immediate solution to the problem, the mess that we are in. The problem, the solution to the problem lies in government and people realizing that controlling the pollution at source, not letting air get polluted, there lies the answer to the problem of air pollution. Air purifiers, masks, closing the schools, odd even, closing constructions, these are all knee-jerk reactions which are not a permanent solution to the problem.
Indeed, Dr. Kumar, it was very rightly pointed out from you that we only with collective efforts can curb air pollution. So thank you so much for joining us today and highlighting what precautionary measures we can do to make ourselves safe from air pollution. Thank you, sir.
Thank you.
You were listening to a discussion on safeguarding against air pollution. The participants were Dr. Arvind Kumar, pulmonologist, Medanta Hospital, and Omvesh Upadhyay, AIR correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may email your opinion about this program at airnsttalks@gmail.com.